Welcome back to Sneak Peek Week. This is the final episode in my special mini-series where I've been giving you a behind-the-scenes look at some of the presentations and speakers inside the Obesity Medicine Nutrition course. Today's guest is Jeannie Boyer. She's a registered dietitian and behavior change expert who contributed not one, but two powerhouse presentations to the course. In this sneak peek episode, we're talking about how to reframe weight loss plateaus, shift the focus away from the scale, and stop labeling patients as non-compliant. So if you've ever had a patient say, "Oh, I can't do this," this conversation will give you a way better way to respond. And don't forget, you can get 15% off the full course with code POD15 at examroomnutrition.com/course. All right, let's wrap up Sneak Peek Week with one of my favorite voices in obesity care. Let's meet Jeannie. Jeannie, thank you so much for coming on to do this special edition of the podcast. I'm really excited to give a little teaser to some of the presentations you did for the Obesity Medicine Nutrition course. Nice to see you again, and thanks for being here.
You too. Thanks so much for having me.
All right, Jeannie, you are a rock star because you actually did two separate lessons in this obesity medicine course. And one of your presentations was about bariatric nutrition as part of the special populations module. That one is a fantastic refresher for anyone who either works with patients who've had bariatric surgery or maybe individuals who are considering it as part of their weight loss strategy. So that one is a fantastic presentation. But today, I wanted to talk about your presentation entitled Troubleshooting Weight Loss Plateaus and Treatment Failures, because we can all probably imagine a patient who is just struggling and we might label them as non-compliant. And so if you could summarize this talk maybe in one sentence, what would you say?
First, I'll say when you say non-compliant, I'm like, ugh. But I would say see the individual and their surroundings. So it's like not just this individual person, but what is their environment? What are they dealing with?
And so in your talk, you gave us some strategies for reframing failures. And so I'm curious if you could just give us a little taste of one of your favorite strategies for doing that.
Yeah. If they come in feeling like a failure, you want to try to flip that script. Like, okay, well, what went well? What did you do? Like, what have you accomplished that we can build on? Because focusing on the failure isn't going to produce any change.
Yeah, exactly. And often when we focus on the failure or the patient focusing on the failure, they feel like they failed as a human, as a person, that they are just awful at this and they'll never be able to achieve their goals. Whereas I love how you taught us to flip it and to say that the plan failed or that diet pattern failed or whatever the goal was too big and that's what failed them. And so that you can make some small adjustments to make it more doable. Now, you shared this tip at the end of your presentation and it has stuck with me. So I had to give a little teaser for the people on the podcast about your favorite way to help people make goals that are not weight related.
It's my favorite thing too. I probably use it every week. So I picture a whole legal pad, but big piece of paper is what you start with. And you have your patient client put down that if it's a weight goal, put down those 3 digits, whatever they are, at the top of the paper. And then the challenge is you fill up that entire paper with what comes with that number. Like, what are you imagining comes with 199? 150 pounds, whatever. Is it that you move better, that you do a 5K, that you hug your person all the way around, or that you run around with kids, or you wear the dress? Everything that you are imagining, how you feel, what you think, what you do, how you look, all the things. Fill up the page. And then you tear off the number and throw the number away. Because those 3 digits don't mean a dang thing. It's all the things that you are going to do. And you'll probably find you accomplish those goals at different weights and feel just as good.
It's so powerful. And you guys can use this strategy like today with your next patient because they can focus on the outcomes instead of just that goal, right? Those non-scale victories often too mean more to the patient as well. A number is sort of this obscure, intangible goal, whereas I want to play on the floor with my grandchildren is something very palpable and something that they highly relate to. So that is my favorite strategy from that presentation. It was so, so good. Okay, what is the biggest lie about behavior change or weight loss that you hear time and time again?
Ugh, it's just that people are lazy or that they didn't even try.
It is. And I think that's an unfair assumption of our clients is, assuming that they're not trying hard enough. They just gave up. Lazy, I think it should be considered a bad 4-letter word. Well, Jeannie, thank you so much for being such an expert speaker within this course. You contributed so many fantastic presentations here, and you gave us so much value and so many things that we can walk away with, and in turn, use it to help our patients change. Jeannie, thank you so much.
Yeah, thanks for having me.
I hope this conversation with Jeannie gave you a fresh lens on how we talk about plateaus, failure, and what success really looks like. But troubleshooting failures isn't all Jeannie covers inside the course. She also led a full presentation on bariatric surgery as part of our special populations module. Now, with all the buzz around anti-obesity medications, bariatric surgery is often overlooked and forgotten. But for many patients, it's still a powerful and effective treatment. In her talk inside the course, Jeannie breaks down who qualifies for surgery and who would be a good candidate, how to answer common misconceptions with confidence, and the exact nutrition strategies to follow immediately after surgery, a few months out, and even years down the road. Because you never know when a post-bariatric patient shows up on your schedule. And when they do, you'll be ready with advice that's not just helpful, but accurate too. Inside the Special Populations module, you'll also hear from Dr. Basma Ferris. She's a registered dietitian turned OBGYN who teaches the PCOS module. She shares powerful nutrition strategies to help your patients manage insulin resistance, improve fertility, and actually feel better in their bodies. Now, I hope you've enjoyed this mini-series and a sneak peek inside the Obesity Medicine Nutrition course. So I just want to leave you with this. Picture yourself 6 months from now. You're still in clinic, still caring deeply about your patients. But the same patient questions keep coming up. What diet should I go on to lose weight? Why am I so tired? Do I have to take this medication forever? And you still maybe don't feel 100% confident answering them. You're Googling between visits, piecing together advice you've seen from half-watched presentations, wishing you had something better. But here's the thing. That version of future you is totally avoidable. Now imagine this instead. You're in clinic. Your patient is looking for advice to lose weight, and you know exactly what to say. You offer 3 doable strategies. You know how to communicate. Your patient relaxes, and you feel calm, clear, confident. That's what the Obesity Medicine Nutrition course gives you. Real-world tools, smart language, actionable strategies you can use in your very next visit. So ask yourself, which version of future you do you want to meet in clinic? Now, when you're ready, head to examroomnutrition.com/course and don't forget to use code POD15 for 15% off. Just for you, my lovely podcast family. All right, my friend, that concludes our Sneak Peek Week mini-series. As always, let's continue to make our patients healthier, one exam room at a time. I'll see you next week.